Hi, my name is Jaclyn Clarke, and welcome to my presentation on the effects of implementing a focused breathing intervention before a male adolescent psychotherapy group. The transition into psychiatric inpatient hospitalization can cause severe stress in children and adolescents. It has been hypothesized that mindfulness-based interventions can increase emotional processing and one's ability to tolerate distressing emotions. The purpose of my research is to instill a focused breathing exercise in the beginning of the adolescent male group therapy sessions, in hopes that it can promote a sense of well-being and a positive emotional state. By incorporating a mindfulness-based intervention into traditional inpatient group therapy, I aim to reduce the stress and anxiety patients may experience during group therapy while increasing their present moment awareness, focus, and group efficacy. Literature states that mindfulness exercises can enhance relationships, improve an individual's group experience, psychological function, self-esteem, and behavioral regulation. A study by Crowley and his colleagues examined the effectiveness of group mindfulness therapy, or GMT, for adolescents that experience anxiety through self-reports by the adolescent participants and their parents. The adolescents reported reduced anxiety and perceived stress, as well as a reduction in reported attention problems. Research conducted by Arch and Krask found that 15 minutes of focused breathing will decrease the intensity and negativity of emotional responses, as well as increase adaptive responding to negative stimuli. Zenner and her group found that mindfulness-based interventions incorporated into schools improve students' cognitive performance and resilience to stress. The target population is adolescent males ages 13 to 17 that attend the daily therapeutic process group offered through the Chicago Children's Center for Behavioral Health Hospitalization Program. Targeting this population will allow me to address the need to ease anxiety and stress experienced during group therapy within clients seeking treatment at Chicago Children's Center for Behavioral Health. With context to the setting, group participants are encouraged to attend group sessions. However, they may choose not to partake. Group therapy sessions begin with a routine check-in that consists of each client reporting how they're feeling and their goal for the day to the group leaders. The focused breathing intervention will be implemented after the routine check-in. After the intervention, the group will proceed with group topics that are based off a 20-day group schedule that ranges in focus utilizing evidence-based practices. The focused breathing intervention can be broken down into 6 steps. The first step is the group leader will invite group participants to close their eyes and find a comfortable seated position. The second step is the group leader will instruct group participants to unfold their arms and uncross their legs to allow their body to have easy circulation. The third step is the group leader will call for group participants to draw their elbows back to expand their chest. The next 3 steps will be counted aloud by the group leader for rhythm and breath synchronization. The fourth step is the group leader will direct group participants to take a deep inhalation through their nose for 5 counts. The fifth step is the group leader will ask group participants to retain their breath for a count of 5. The sixth step is the group members will release their breath by exhaling slowly through their nose for 8 counts. After working through the focused breathing exercise, the method will be evaluated by asking the participants the close-ended questions of, do you feel a sense of calmness after completing the focused breathing exercise, and do you find this exercise to be beneficial to beginning a group therapy session? The group participants will show their answer by giving a thumbs up, a side thumb, or a thumbs down. The data will be collected over a 5-week period consisting of a total of 15 group therapy sessions. My perception of the outcome data is that more group participants than not will feel a sense of calmness after completing the focused breathing exercise, and will feel that the exercise was beneficial to beginning a group therapy session. This meaning that 51% or more of the total group participants will respond that they feel a sense of calmness after completing the focused breathing exercise, and that the exercise was beneficial to beginning a group therapy session. Due to unforeseen circumstances, I was unable to collect such data and report my findings. Other recommendations include having a more diverse population, since my findings would have been limited to insured hospitalized patients in Illinois. In future implementations, I would prepare for the changing group dynamic and structure. This research is limited in its findings of mindfulness-based techniques within clinical settings for youth. Conducting research on the effectiveness of using mindfulness techniques in a clinical settings with adolescent males ages 13 to 17 by implementing focused breathing in group therapy sessions will prove useful to the growing body of literature. Thank you for viewing my presentation. I hope to one day implement this intervention and continue exploring the benefits of mindfulness-based interventions.